Warm welcome from the team here in Geneva to this launch webinar of the roadmap on the public health and emergency workforce, looking at the functions, the competencies, and the measurement and classification of this. Just some brief housekeeping, if I may, before we start off. We do have interpretation in a listing of the official languages. Please do take the opportunity, if English is not your first language, to select and take that forward. I'm asking colleagues as well, if panelists and speakers, if they can just please observe standard webinar-based protocols with mute and to speak slowly and clearly so the interpreters can make sure that they keep up with you. We do have the chat function enabled in the call, and please do use that opportunity to engage with the panelists. We'll have a session, as you saw from the event, Q&A, where we'll look forward to your comments and suggestions coming through. As if you have on the naming convention, please make sure you have your name and institution links as we pull up your questions accordingly. The roadmap we're presenting today is the result of an absolutely fantastic partnership across many of the world's schools of public health, associations of public health, the international institutions, the global outbreak alerts and response network, and a grouping of many partners. It follows on from the work last year led by the Italian G20 presidency, which at the height of the COVID-19 pandemic, clearly the role of public health, the role of the public health workforce to be able to respond to a global pandemic was a political concern, a technical concern, and a societal concern. This work builds from that. The roadmap that we're launching today, and which is available, published on the WHO website, please do take an opportunity to get engaged with that, really is a vision for strengthening national capacity around the world for the essential public health functions, the preparedness and response role for health security and universal health coverage. Making sure that we really balance equity and leave no one behind. The elements of that, as we'll hear throughout the day, we're going to give you a detailed presentation on some of the elements of the roadmap and its progressive matrix, how we benchmark progress and reach full implementation of some of the tools and opportunities, and really to engage not just with the partners that have already been extremely active in this last 12 months to work together, but engage around the world with all the different stakeholders involved in functions education and the systems and workforce components of it. Obviously, the national schools of public health, the associations of public health, represent the member states of WHO. And it is through them and with them that we are very much looking forward to taking this activity accordingly. So we have an opening session now where I'll invite one of the Assistant Director Generals of the WHO Health Emergencies Program to give remarks, followed by a panel of speakers and partners that have been engaged, a question and an answer session, and then some closing remarks at the end. And we hope this really gives you an excellent overview and understanding of some of the key elements of the work. So let me turn now to Dr. Sose Fowl, the Assistant Director General from WHO's Health Emergency Program, for the opening remarks. Dr. Sose.
Thank you, Jim. Good afternoon, colleagues. It's my pleasure to be part of this launch. I'm very pleased to see colleagues I haven't seen for so long. Neil, Duncan, Dale is here. It's not so long I met with him. And Laura, of course. So it's really a pleasure to be with you. It's a very important event. And we have so many ongoing, events and emergencies. In addition to COVID-19, the situation in Ukraine is some fragile countries, like Ethiopia, Afghanistan, and this just reminds us that we are not adequately prepared to prevent such emergencies, and we cannot continue doing the same thing, expecting to be better prepared. We need to do something differently. And secondly, we need to strengthen capacity of member states to be better prepared to prevent, to detect and respond to health emergencies, while also strengthening our coordination at regional and global level with our existing network. And thirdly, also remind us that health is strongly linked to political stability and socio-economic development. If you don't take into account the overall context in countries, and it will be very difficult to have the right outcome. That's why we are working together on what we call the global architecture for health emergency preparedness, readiness, and response. The DG is going to present next week during the assembly. In addition to that, we have so many other processes going on, looking at the international health regulation, the pandemic treaty or accord or agreement also is another process, but we expect that all these processes will contribute to better health outcome at country level. And so with regard to the roadmap, I think this is extremely important because defining the function and services the workforce needs to deliver and tailor it to the country and subnational context, because as you always say, you cannot have global if you don't have national and local. No global surveillance without local surveillance, no global workforce without national workforce, and so it also, help to understand the competencies needed to deliver an essential public health function and how the education and lifelong learning material and resources should be designed and delivered. And also help in mapping out and measuring the various occupations within and outside the health sector delivering on essential public health function. We talk about, whole of society, whole of government approach, but to do that, we need to be clear about the public health function we are talking about. Otherwise, it will just remain slogans. And so I think it will guide the overall public health work. And within it, clearly, we have some more specificities when we talk about health emergency response. That's why also we are working to make sure that we have the right workforce to, we are calling health emergency alert and response team, to make sure that these people are well-trained, multidisciplinary, and ready to be quickly activated, working closely with national public health institutions. And clearly we expect, a lot of joint work from the GIM team to make sure that when we work specifically on health emergency component, we can do it together and also have more shorter timeline. And where we can deliver quickly, we have to do it while working on more longer term sustainable capacity. I think this is extremely critical. And so I would like to thank everybody who contributed to this very important work, and take this opportunity to reiterate WHO commitment to continue working with all of you for the interest of countries all over the world. Thank you, Jim.
Thank you, Dr. Sose, and exactly that. It's WHO's role as a convener in support of actions of member states depends on that wide, extensive partnership with all the stakeholders and panelists and guests that we have today. When we're looking at the workforce around the world, obviously we want to strengthen the capacity of the existing workforce, but also to really develop the workforce of the future, looking at the pre-service, undergraduate, postgraduate education and development, and the role of early career professionals as leaders in our health systems worldwide. And so it's with real great pleasure that today's presentation is from two outstanding early career professionals, Dr. Marine Hunter and Dr. Fatai Ogunlayi, who will take us through the overview of the roadmap. Marine and Fatai, the floor is yours.
Thank you so very much, Jim. Good afternoon, esteemed colleagues. My name is Marine Hunter, and I'm a public health medicine registrar with the University of Cape Town in South Africa. My colleague, Fatai, from the Faculty of Public Health in the UK, and I are privileged to be here today and discuss this exciting initiative by the World Health Organization and partners associations. Next slide, please. For more than 2 years, COVID-19 has stressed public health responses and exposed weaknesses in existing health systems across the globe. However, despite its tragedy, it has also reminded us of the interconnectedness of the systems of health, society, and economics, and how addressing the social determinants of health with a resilient public health workforce at the helm is integral to health system strengthening. Our ability to establish well-defined competencies for public health practice that are uncomplicated in both implementation and management, as well as able to amass public confidence, will provide the opportunity to both protect and improve public health, especially in times when misinformation, seeded through fear and doubt, threatens our very ability to achieve these aims. Next slide, please. Therefore, the call for building the central workforce was answered through the collaborative development of a roadmap by various leading public health organizations and associations. From the G20 Italy Declaration to a discussion paper in November last year, followed by expert consultation in January 2022, these organizations worked hard to establish a core working group of partners who constituted to the roadmap's co-development. Next, please. The vision of this roadmap is to establish a strengthened workforce in every country, delivering all the essential public health functions, including emergency preparedness and response, for the aim of achieving universal health coverage, health security, and improved health and well-being. The purpose of this roadmap is to outline the actions to identify the skills and competencies needed, develop a shared understanding of the scope of practice of the workforce, provide high-level guidance and develop public goods, and to mobilize global public leadership and stakeholder engagements around an integrated approach to strengthening the public health workforce. Next, please. The workforce which delivers these essential functions comprises all individuals who contribute to the delivery of at least one of these functions as part of an integrated services and systems. This workforce is not a single occupation, but a grouping of diverse occupations from both the health sector and from other sectors.
Next slide, please. Thank you very much for that, Marine. Hi, everyone. My name is Fatai Ogunlayi, and I'm a public health registrar with the UK Faculty of Public Health. Picking up from the point made by Marine on the composition of the workforce, we know that there is broad interpretation of the workforce delivering essential public health functions. There is also widespread variations across different systems regarding which occupations and which educational background and personnel are performing these public health functions. The conceptual approach that we are going to outline here shows us how we scope, define, and build the capacity of public health workforce. There are 3 action areas which are interlinked and interconnected. If we look at the first action area, which involves defining the essential public health functions and the services that are associated with them in different countries and subnational contexts. This builds on the work done by WHO in 2021, which developed a consolidated list of 12 essential public health functions that countries can use. As part of this action area, the next step will involve disaggregating these functions into sub-functions so that we understand the tasks and the service delivery level and the individuals involved in delivering these functions. This exercise will hopefully highlight synergies which are of relevance across multiple EPHFs and also enable a more holistic approach to developing public health capacities and public health workforce. Over to you, Mary.
Thank you, Fatai. All right, so with regards to action area 2, The exercise from Action Area 1 will provide the opportunity to comprehensively identify the skills and competencies required by public health personnel through the mapping and consolidation of the existing frameworks. Action Area 2 will bring partners together to collaborate and to develop a modular education program targeted towards defined and prioritized components of the essential public health functions. This would then allow the said workforce to be equipped with the right level of skills, competencies, and knowledge. This action area has the potential to enhance opportunities for career progression and professionalization of the core public health workforce. Back to you, Fatai.
Thank you. So if we now look at Action Area 3, mapping and measurement of occupations. As we know, public health workforce is broad, but many of the occupations performing components of the essential public health functions are not identified as such, nor have they been properly classified in the International Standard Classification of Occupations. This action area will facilitate a standardized measurement approach, which all countries can apply to identify various occupations involved in the delivery of the EPHFs and map them to the individual national standard classification of occupations, and then align this with the international standards. This will help all countries to monitor the size of the workforce, as well as allow for cross-country comparability. This will also provide the opportunity to align with the process and the successes that has been shown with the WHO's National Health Workforce Account. So if we move on now to the operational approach slide, please. What we've described so far is the conceptual approach to the roadmap. The question now is, how do we implement it? The roadmap recognizes that each country may very well be situated at different thresholds across the 3 action areas. And as such, implementing the roadmap will require a differentiated approach at country level that will take into account its national capacity and context. Hence, the roadmap proposes a progression matrix that will, 1, aid countries to benchmark themselves and assess their current situation. Use this information to identify gaps and develop national plans, and support progress to the full implementation level in each of the action areas, with the ultimate aim of achieving a strengthened workforce in every country, delivering all of the essential public health functions to support progress towards the universal health coverage and global health security, as well as improve population's health and well-being. So if we move on to the next slide, please. And I guess the question is, what can we do to help? What can we all do to help? Well, operationalizing the action areas outlined in this roadmap requires the support of a broad coalition of partners and stakeholders with diverse expertise ranging from policymakers to civil society organizations. So we're calling upon all of you, all interested parties, to join us in this roadmap and to build partnerships at country, regional, and national levels, so that we are all equipped with the resources needed to drive progress on the essential public health functions and emergency preparedness and readiness in every country. In terms of what happens next, well, there is an opportunity for further collaboration to co-design tools and guidance to develop a competency-based education program with the aim of establishing a globally skilled workforce. Over to you, Maureen.
Thanks, Fatai. Next slide, please. So what does this all mean? The recent global pandemic, coupled with other ongoing and emerging healthcare threats, has demonstrated repeatedly the need for a coordinated, established, and trusted public health expertise on local, national, and international levels. This roadmap is intended to pave the way for individual countries, the WHO, and partners to work synergistically to develop a critical mass of public health professionals that can confidently, comprehensively, and expertly deliver on their essential public health functions, adapted to their individual context. This will not only serve to establish more resilient and supported healthcare systems, but also create a trusted body of personnel to whom the public can turn in times of uncertainty and health system strain. Thank you very much.
Thank you very much, Maureen and Fatai, for that very succinct and concise overview of the key elements of the roadmap. So colleagues, the document is live, it's published, it's on the website. You can get further information there. The PowerPoint will also be posted to the event site as a summary coming forward. Collaboration is at the heart of this roadmap. And on the event website, you'll see the opportunity for your organization, your institution, your school to express interest, endorse the roadmap. And already today we have schools from around the world, from China, from America, from India, from Italy, from the UK, already identifying their support and enthusiasm for this work. And I'd like to thank in particular two of the schools that have provided support already. Professor Brusaferro and his team at the Italian Institute of Public Health, who led the G20 deliberations, as you saw from the slides. Last year's Italian G20 presidency really put this workforce issue at the heart of the political deliberations. And also our former Director General, Dr. Margaret Chan, now the Dean of the School of Public Health in Tsinghua Vanke School of Public Health, for her support and endorsement. So we carry forward that collaboration there. And that's the point of our next discussion. So from our early career professionals, I'd now like to hand to one of the senior statesmen of public health around the world, Professor Duncan Selby, that has been teaching all of us what public health is for many years. Professor Selby is the president of the International Association of the National Public Health Institutions, and he's going to introduce you to a distinguished panel from around the world. Duncan, the floor is yours.
Jim, thank you so much. I'm not entirely sure how to take that part of the. I feel young, and listening to Marine and Fatai, with a brilliant introduction to this. Congratulations, guys. We are hugely supportive of this roadmap. It could not be better timed. The essential public health functions have been at the heart of our thinking as National Public Health Institutes for many, many years, and have helped us understand what the functions ought to be and what the competences might need to be. But we've never had this focus before, and we were found wanting, and it's very necessary. And so again, the timing of this is just perfect. So it's great to be with everyone today. We have 4 panelists who have been asked to share their experience of workforce development in their contexts, and to help us think through, as our 2 younger colleagues were saying, how do you operationalize this? How do you make this real over the next number of years? And I think that's key. I think Fatai says, how do we implement this? Which I think is the key question. So we do have an esteemed panel, more than me. We have 4 contributors. We have Professor Flavia Senkabuch, I hope I've pronounced that right, is the president of the Colleges of Medicine of South Africa. So warm welcome. Professor Neil Squires, who is particularly well known to me, is the Director of Global Public Health from the UK Health Security Agency. Dr. Laura Magana, who's the chair of the Global Network for Academic Public Health, and Professor Dale Fisher, who's the chair of GWAN, the Global Outbreak Alert and Response Network. Just before we go straight to Flavia, 3 questions or 3 areas that we've asked each of our panelists to try and cover in 6 or so minutes. The first is to speak about what the key experiences are in their own country settings, about how do you strengthen the public health workforce, how we operationalize this roadmap, how do we make it pragmatic and real, how do we make sure that this remains a priority for policymakers and for politicians. The roadmap is like a brilliant intervention. So we've got to make sure, how do we keep this relevant? How do we keep this on the agenda? And where do we want to be in 5 years' time. I know where I want to be in 5 years' time. Every country is zooming towards the essential public health functions being strengthened with a workforce capable of implementing it. There's no strategy or roadmap that will ever succeed without a workforce capable of implementing it. So this is the most important conversation I think we're having at the moment. So could I hand over first of all to Flavia to share her reflections. Flavia, you have the floor.
Thank you very much, Professor Selby. And I really first want to say what a great honor it is for me to share the stage with a number of friends and colleagues, and just to say hello to German colleagues there at WHO. And Professor Selby, I really firstly want to say that competency-based education is of course rooted in best evidence for educational design. It is of course the most effective way to align the outcomes of public health education with population health needs. But I must hasten to say that it does require quite a deliberate and intentional approach to do so. It's not something that is just going to happen osmotically. We have to be quite intentional. And I guess this is where the essential public health functions come in. And just to say as well that the context is quite important, because if you look at the EPHA framework, it then has to be adapted for national level. And this is why I am so excited about the staggered approach of implementation, because it is then important for each and every single country to assess what those essential public health functions would look like and require for their particular country. And then accordingly, competency-based education curriculum, which is more the space in which I play in, it can then be orientated to those public health functions, and then it can be developed, and then eventually it can be delivered. And so this roadmap, I feel, calls for action to countries to strengthen public health workforce education and training. And this needs to inform then education, yes, but also the standards. And certainly once you've educated people, they go somewhere, and that is the space of employment. And I want to answer the question about operationalizing the roadmap, borrowing the words from the South African 2030 Human Resources for Health Strategy, which we have just implemented. And it really is about the fact that health workers have to be recognized first and foremost as the embodiment and personification of any health system. And I think once we've got that, we will then find that golden thread of each and every single one of the requirements and the desires of the health workforce being implemented across. And I do want to add that the 2030 strategy also talks about it, health workers being the vanguard of the defense of humanity against a pandemic like COVID-19. And I think this is the beautiful illustration in just one sentence that really talks about how do we operationalize it. It's about recognition, first of all, of its importance, because of course, if we don't think that it's important, Selby, we're not going to do it. And I think that in terms of the consideration of, what we want in 5 years' time and how we ensure that, these things happen, we cannot run away in our region about funding. You can talk about health workforce as much as you want, but I think that, as one of my students said to me, Prof, the time for volunteerism is slowly dying away. And so we do have to fund health workforce, and we have to make agreements on the kind of skills and competencies that we need and have them as policies that we can implement. And I want to stop there and hand back to you, Professor Selby.
Professor Flavia, that was brilliant. I mean, context is everything. Competency-based training doesn't just happen. It needs, it's a whole it's the whole of the educational system coming together, connecting to institutes and to other providers of public health services. And I completely agree that the health system is founded on the public health, on the wider public health, the public health workforce. And of course, training people without jobs to go to is linked to your funding point. And if I have a last thing that I can stamp before, is that, a strategy is not a strategy unless it's got a budget attached to it, unless we can see that it's not a plan unless it's got a budget. And you can tell what people care about by asking them, show me your budget. And so we need to make that point really strongly in this. And so I know you made a number of other very important points there, but those are my quick summaries. The focus on competency-based training, of course, context, and you have to have jobs to go to, and you need to have budgets to pay for people, and for training. So we'll come, Flavia, thank you so much for that. I'll move on to Neil. Neil, are you ready to take the floor?
I am indeed. I just cut out there for a minute, so hopefully there'll be no connection problems, but one of the challenges of virtual meetings. But it's a huge pleasure to join this meeting, which for me feels like the culmination of a very long journey to ensure that competency-based public health actually is well grounded in every country. So I'll start by answering the question about the UK context. In the UK, we've spent a number of years developing competency-based public health training. I myself, and indeed Fatai, are examples of people who've been through that training program. It involves a master's degree in public health, but also 4 years of training linked to engaging directly with local government, learning the skills, practically applying public health skills, experiential learning that builds up those competencies. That's for the highly specialized public health, but there's also been a big exercise that recognizes, as Fatai and Marine have highlighted, that public health is delivered by a number of different professional groups. It's not the exclusive preserve of any one single professional. And so we need to identify the full range of public health skills and competencies that are essential to deliver the essential public health functions. And in the UK, that is something that the Faculty of Public Health, working with the National Public Health Institution and the schools of public health, have sought to do, developing a competency framework with different levels of competencies. That work has then been taken forward by ASFA, the Association of Schools, and I see John is here, who's going to speak later, John Middleton is the president of ASFA. But that's been taken forward in Europe by a collaboration between the National Public Health Institutions, IAMPHI, working with ASFA, to define this set of competencies. And that process of regionalizing the competency frameworks in the same way that the essential public health functions have been regionalized helps ensure that we have context specific and context relevant training that meets the needs of individual countries. Moving on to the question of operationalization, then really it is that partnership between schools of public health, working with national institutes of public health, reaching out to the professional training bodies that will help operationalize this. We have established networks with peers working with one another to ensure this strong professional capability. But the other key word is professionalization. It is important that we don't only train individuals, but we create a structure that sustains and maintains those individuals through lifelong learning, continuing professional development. So to have a professional structure which recognizes levels of competencies, which creates a career ladder that allows people to progress and supports people through continuing professional development is essential. The final question on how do we ensure political ownership and leadership of this? I mean, I think we now need to ride the current wave of political interest in global health security. And that's why the roadmap with its emphasis on essential and emergency workforce is critically important. And we need to highlight the role of particular subgroups. So it's a real pleasure to see Tefinet here representing field epidemiology training, for example, as one key component of those groups who need to contribute to not only the current pandemic, but to help us prepare for current and future threats, including climate change. So there's a very broad agenda that's contained within the essential public health functions that collectively, through existing peer-to-peer networks, I could think we can help champion. So an excellent presentation from Marine and Fatai demonstrating the value of developing public health professionals who have the skills and competencies necessary to support this important agenda. Over.
Neil, thank you as ever. I was never quite sure what to add after your contributions, Flavia, too. Practically applying skills seems the thing that most people are seeking around the world. Public health is everyone's business, and I think we've proven that the connection between health and wealth, and that there is no separation there. We have to be paying attention to the public's health and how the workforce brings all that together, and pathways for people, career pathways, continuing professional development as part of that, and maybe something about parity with healthcare professions, so that we make it attractive financially and in career terms for people to choose public health. Now, I've been in and about public services for over 40 years, and I didn't start learning until I got into public health, and I wish I'd been there 30 years before. So I would be commending everybody to go into public health if we want to improve the health of the people. As important as a healthcare system is, we know that it's even more important to be concerned with the wider public's health. So just making this a really exciting career option, as well as a financially attractive one, and one where we, as you say, we're investing in continuous lifelong learning. Neil, thank you so much for that. And we'll be hearing from John, as you say, and I think he may say a little bit more on professionalism. Shall we move to Dr. Magana? Do we have Laura?
Sure, here.
I can see it. Hello.
Thank you, Professor Selby. How are you? Well, thank you. This is a tremendous honor and privilege to be with all of you today, to express our support for this timely and really important initiative. I'm proudly right now to represent in this panel the Global Network for Academic Public Health. So we are an alliance of 7 regional associations that represent schools and programs around the world, including Latin America, Asia Pacific, Africa, European region, America, Australia, and Southeast Asia. So our goal is to enhance academic public health worldwide through mutual learning and collaboration between academic public health institutions globally. So we see value in the multicultural, multinational, and multilateral engagements and partnerships. We understand that the challenges of the public's health are many and varied, and had never been greater as our lives and our environments become more complex and interdependent. Right? So we need to ensure that the public health workforce remains at the forefront in tackling these challenges now and in the future. There's an increasing evidence that improving health and tackling inequities requires a strong public health workforce capable of delivering the public health functions, of course, across the systems. So we are also strongly believe that to improve health and well-being outcomes for everyone everywhere, we need to ensure universal availability, accessibility, acceptability, coverage, and quality of a diverse and competent workforce. So that's why this roadmap offers a blueprint for countries to assess themselves on the 3 action areas and develop action plans to progress forwards. So globally, countries can learn from each other, and that's exactly our alliance that is for. And regionally, there can be increased collaboration to pool resources and expertise. So this implementation can be enabled through evidence-based guidance, innovation, and disruptive ways of thinking to reassess public health education, research, and practice. In October 2021, our global network released a paper, and I quote, "Global Governance for Improved Human, Animal, and Planetary Health, the Essential Role of Schools and Programs of Public Health." In that paper, we outlined that the critical role of schools and programs of public health in really responding to the current pandemic. We also talk about the additional skills the public health and emergency workforce needs, the basic public health knowledge that government officials and other decision makers need to protect their communities during crisis, and the essential requirements for global governance for health and improved responses to future pandemics and health threats. So our work is fully aligned with the roadmap released today and with WHO and our partners. We call for substantial investment in public health, in education, in training and research, particularly through schools and programs of public health worldwide as leaders in this area. So responding specifically to your questions, number one, I want to make this point. What our academic institutions are called to do in these unprecedented times is to fully transform educational systems to prepare the workforce that we need. It's not just about just adding, changing this, changing that. We need to really be able to take this opportunity to transform the way our institutions are teaching and all the environment of the learning environments, even the curriculum, the competencies. We need to consider that the students will be lifelong learners. We're not going to have just the students just one time for their bachelor's, their master's, or doctoral, and then they're gone. No, from now on, we know that that student is going to be, the lifelong learner with us. So with that, all our institutions, the educational institution has to transform just to allow for re-entries during all professional life, but also the health systems and other employers, they need to also give the opportunities for their people to be training throughout their professional lives. So it's a call for a lifelong learners as opposed to one time education. Secondly, we need to modernize and amplify learning environments by embracing online education, hybrid, intense on-site, micro-credentials, and so many other models. So embracing the workforce learning everywhere it can occur. Of course, competency-based education, as you all were mentioning, is the key to maintaining a capable and up-to-date workforce. So what do we aspire in 5 years? Hopefully we can see all these models throughout the globe, really transforming the educational system in order to really keep with all these challenges for the workforce. So the public workforce is at the core of the health systems and all essential public health functions. So operationalizing this roadmap has the potential to tremendously strengthen the health systems of countries around the world. So number three, my last point is that you have already raised, that in our complex and interdependent world, it's urgent that we invest in strengthening multi-sectoral interprofessional collaborations among ourselves and between academia and practice partners in order to really advance our common agenda. And of course, we can do that through the implementation of the public health and emergency workforce roadmap. So we are really looking forward for a really exciting future, and we are ready. We're grateful for this opportunity to work together in this endeavor. Thank you.
Thank you so much, Laura. There is such synergy and alignment. And, without our schools of public health, where would we be? I mean, and your point on the transforming, I think is, the future is a really positive one. We need to just use this opportunity to make those changes happen. And as we move in the way that you were setting out there together and learning from each other, you raised equity, which is, of course, again, at the heart of the essential public health functions. And unless we look out for those at the wrong end of everything, then we will never close the gap between those that enjoy and those that don't enjoy good health. And this is at the heart of what it means, I think, to be in concern with the public's health. And you've raised one health, which is the wider agenda we're all traveling. And lifelong learning. And so I'm going to forgive Jim for his entry about my stage of life, because I believe I've only just got started, Jim. And I'll be following the roadmap personally. Laura, thank you so much for those for those remarks, and I'll pass on, if I may, to Dale, if Dale is with us and ready to go. Do we have Dale?
You happy?
Yes.
Can you see me, Duncan?
Oh, you're in the room.
Yes, I'm in the room.
Oh, hello, welcome. You have the floor, Dale.
I've just satisfied a lifelong ambition to take Sose's seat. So thanks, Duncan. Thanks, Jim, for pulling this together. Maureen and Fatai for their information earlier on. So, being the last panel speaker, it's always challenging to try and say something different. And I think what I might do is just aim for a few more specific things that relate to what I hope to enunciate as a go-on view, but certainly my view. And with the first question about essential public health functions, particularly in an outbreak response, I would say that what we've witnessed during COVID is actually not particularly different in terms of the components of an outbreak response than we see in other outbreaks. It's just bigger and more widespread. So those components, being case management and infection control and laboratory and epidemiology with contact tracing and all the logistics necessary to ensure the right procurement and security and transport and salaries, and of course risk communications and community engagement and managing mental health and well-being, ensuring that essential health services continue without complete distraction from the outbreak. These are what we'd regard as the sort of core pillars of outbreak response. And fundamental to that is the leadership and coordination of all those features. And really, if any of those are missing, particularly coordination and leadership, then it all falls apart, no matter how good you were at the start. And I think that's what we saw in some of the pre-pandemic assessments. They didn't align particularly well with the outcomes. So this is a lot of what we do in our go-on trainings is not so much train people in those basic skills, although that's important, but that's not our role. Ours is more in, if you like, respect and an interdisciplinary understanding and appreciation and cooperation between groups, whether it's diplomacy or relationships with policymakers and communications in general, particularly community engagement. These are, what we call, sometimes unfairly, we call them the soft skills, but they're arguably more important than the technical skills. And what we've seen through the pandemic is the ability of workforces to adapt, often repurpose, and I think this would be what a strong future workforce looks like, is that they've got their basic skills, but they can repurpose at the time of a major outbreak or a stress to the system. And as we know around the world, general surgery had to be elective surgery was by and large cancelled, and those people might have gone out and been doing other things, contact tracing or swabbing centres or whatever. And I think that this is kind of important in the global workforce approach. What we also saw during the pandemic was some countries paid more attention to their workforce than others, while some countries might have just been saying, work harder, do more shifts, do longer shifts, do this job even though you're not trained for it. This wears people down, and we know there's been a huge attrition through this pandemic, and I think that needs to be a leadership skill that and from the top leaders to the managers to make sure. And in some places they were getting cash rewards, other places food, other places it was just good communications and verbal recognition. But in some cases where they were just taken for granted, I think that was a big problem that reflected. In terms of how to operationalize the roadmap, I would say there's one crucial moment that has to happen soon, and that is documenting what just happened, identifying the problems, the after action reviews, if you like. And if countries don't do that and they don't own up to what the deficits were in a no blame way, it's just the way it is, then I think you struggle to solve problems if you haven't identified the problems and documented the problems. And I think the international bodies or national bodies should be pushing for this to be done. And because let's face it, the global health workforce roadmap is a solution, and we're assuming everyone agrees with the problem. So I would say documenting the problem will lead to the buy-in and ultimately an implementation strategy. So where do we want to be in 5 years? We want baseline capacities at a sort of a minimum standard, if you like. We know that healthy populations and healthy systems create a resilience to stresses like this. But if you're already starting in it with a system that's suffering, then you're extremely vulnerable as a population or as a health system. Moving beyond those sort of baseline characters, we'd like to see rapid response capacities developed at a country level. So rather than 20 experts being airdropped in, those capacities need to be strong at a country level, and they need to be stronger in the more vulnerable countries where perhaps these events happen more often. That's not to say there's no role for international input, but certainly rapid response capacities, building on stronger surveillance and stronger alert, then you've got the people on the ground that know the system, that are well networked, and they can start rolling out the appropriate response. And I guess finally is the ability of a workforce that can pivot as needed during a crisis, and systems that can manage the surge that necessarily occurs during that crisis. So I'm not sure I said anything different to anyone else. I just said it differently. Thanks.
What you did there was say it beautifully, and you just spoke about the essential public health functions across the broad range, and you spoke about context, which is everything. And again, Marine and Fatai talked about that and the graduated nature of how we take this forward. We have to be real about the starting position. So your point on documenting and benchmarking and doing that in a way that is encouraging and positive, and and that we can help with this by how we work together on this. And you spoke about the soft skills, and you said they may be more important than the technical skills, and the technical skills, of course, are the foundation, but the soft skills are what enables you to get heard. If you want to be heard, you need to first listen. And if I'm thinking about my own reflections on leadership and back to particularly about how do you work with politicians? How do you remain in the room with politicians when they don't appear to be listening? But you need to stay in that room, and being right isn't sufficient, and there are other factors affecting. And how do you make sure that you can still be heard in that? And I think that is new in thinking about how we teach and how we do continuous professional development. So I love the way you put all of that, Dale, and I think it aligns very well with what our other colleagues have been saying. IAMFE will be publishing tomorrow a lessons learned from the pandemic, and it will speak about the workforce, and we will seek to learn again from this conversation today, and particularly, Dale, what you were adding there, as we take that work forward. So I want to, can I say the biggest possible thank you to Flavia and to Neil and Dale and Laura. Biggest thank you to Jim. Did I remember to say that? Because actually without Jim, we would not be here today. And whilst we have massively great partners around this, it takes someone to organise, to say that it really, really matters, and then to make sure that it happens. I found in public health that if something really, really, really matters and they say no to you, you just take it as the next question. You never, ever, ever give up. And all the contributions that we've had about the academic and the partnership between the implementers and academe, the importance of the multi-sectorial, diverse, the context, everything, and the importance of investment. So my last comment, handing back to Jim, is I think we should raise this issue in every forum that we are in, and that we should make sure it's on every agenda that we are part of. And I know that our colleagues here commit to that, and IAMFE commits to that, and we will make absolutely all the right noises and a lot of noise about this, because it is probably, I think, actually the most important priority we face. Jim, can I pass back to you to move us on?
Thank you very much, Duncan. Professor Selby, with all due respect on the senior statesman, it's not anything to do with the age. But Duncan, thank you very much for that, and an appreciation for the word of thanks, which by default goes to all colleagues in WHO who've been working on this initiative accordingly, without which the work is always a challenge for one person. It is partnership within WHO. It's partnership with the emergency team. It's partnership with all the external stakeholders. So we're going to go into, and we're spot on time as well, so which is excellent moderation. We're going to go into the Q&A section, and I'm going to invite Professor John Middleton to moderate this. The Q&A function in Zoom is open. There are open questions and some answered questions as well by text. But John, the floor is yours, and engage with the panel as you seem fit from the key issues that are emerging.
Thank you very much, Jim, and thank you for the invitation to be here today. I would like to say that the Association of Schools of Public Health in the European region is fully supportive of this initiative, and we have, with our work with WHO in Europe, we've recently published the professionalisation roadmap, which is very complementary to the work that is contained within the this launch paper, and we will be delighted to support colleagues at national level, at school level, and indeed through WHO networks, and indeed through the global network of academic public health. Now, I'm trying to do a juggling act with the chat box open to my left and the question and answer opened to the right. A number of the questions have been flooding in, which is heartening really, because sometimes you can do these meetings and nobody asks a question, and it does show the incredible level of interest amongst our nearly 400 participants. I'm going to group some of these questions because there are clearly questions around the multidisciplinary nature of public health. Vital that we recognise and celebrate the range of skills and disciplines that are engaged in public health. They are writ large, I think, in the current document around the people who may only be involved in a single essential public health function, but what a function that might be it information, be it vaccination, be it any number of other vital functions that we have. And then, of course, we're trying also to extend and recognise the skills of the public health specialist and as well as acknowledging that wider skills are involved across the public health as everybody's business. So I'm looking the questions from Germany about physician's assistants, comments around nursing, comments around how we define and recognize all of these skills that are needed in public health. And I'm wondering, could I invite Neil to respond to that? How do you think the experience of multidisciplinary public health is to be recognised through this roadmap?
Well, I can certainly draw on the UK's experience of developing multidisciplinary public health. So the Faculty of Public Health in the UK is part of the Royal College of Physicians, but it's one of the colleges that is no longer exclusively for physicians. The faculty made a decision a long time ago recognizing the skills and competencies that nurses, health economists, environmental health officers bring to public health, that those senior leadership roles need to be drawn from the full range of professional groups that can contribute to public health's delivery. And so the public health training course in the UK is the same, whether you come from a medical background or from a nursing background or from a health economics background. There are very high entrance requirements to become a specialist, but that broadening of the competencies recognizes the importance of that broad range of disciplines. But that's about the leadership role. In terms of delivery, then clearly there have always been a wide number of different professional groups that deliver the essential public health functions. And I think I've seen in the chat various comments that it is the team that is important. Individuals collectively can deliver the full range of essential public health functions. And I think that's particularly important in lower resource settings where the luxury of developing a large number of highly trained professionals, which takes time, is not there. But if we can provide training that equips different professional groups with the skills and competencies, then collectively that team can deliver all of the essential public health functions. And that means we can deliver fast and meet needs quickly, which I think is critically important, as we've seen in the COVID response. Over.
Thank you.
John, can I add something? Because it was actually a couple of questions also in the chat about that, Neil, and I completely agree with you. And I just want to add that we always expect that when we're working, we work intersectorial, in teams, and health in all policies, but we never think that in order to do that, we need to start actually in education. We need to start building that. And when we talk about the transformation of education, is because we need to do more interprofessional. We need to educate people interprofessionally in order to then be able to work interprofessionally. So I think that in this transformation, one of the topics of the area is how do we make sure at least all the health professionals should have what are the common areas, and public health is like the perfect space to be the common area where all the others can just build their curriculums. But as mentioned in the chat, I completely agree. It's not just the health professionals. How do we make sure health and well-being of public health is actually in the curriculum of the architects and the engineers and the lawyers and the others, because we need them all. So I think that when we think about ways to really transform our curriculum, our education, we need to just to think beyond our own silos and start really working together to a common curriculum, even beyond the health professionals, if we really want to practice that way.
Thank you very much, Laura. There's also a grouping of questions really about assurance, some of it around how do we assist low and middle income countries to put in place professional systems. There was a question also from, let me see, Atif Ben Alita, which seemed to be about what were the mechanisms to assure the continuity of essential care services and the standards for medical and paramedical staff providing essential care in the example of the COVID crisis. I'm wondering who would like to comment on how we assist in through this roadmap, how we assist in the development of professional systems for public health wherever they are in the world. I think I'd like to go to Fatai and Marine to maybe say how you think you should be, how you think in your future you should be regulated, or people should be assured of your standards. Are you there for Marine?
Yes.
I can.
Thank you so much, John. Fatai, would you like to start?
Yeah, absolutely. Thanks very much, John. So I think one of the things that the roadmap recognizes is that different countries will be at different stages of the action areas that was highlighted. And so it's building on the national context, the national policies, national training programs that's in place. I think there is something to be learned about the professional group, or the group that can oversee the training and development. So for example, in the UK, we have a competency-based program and a regulator that assures progression right through, that every individual that comes through that is equipped to a particular level before reaching the stage of consultants and leadership. But I also think there is something in there as well for the wider workforce, and allowing them to be recognized as part of the public health workforce. I think it might be yourself, John, who mentioned that there are such a broad range of individuals doing this role, and it might be one element of the essential public health function that they're doing, but it is probably a very critical element of that function. So how do we recognize that? So in summary, I'm saying there is something around the leadership and the specialist in public health, and how do we get them accredited in whatever the relevant organization that might be, and how do we recognize the broader workforce that are delivering on the essential public health functions. Over to you, Maureen.
Thank you, Fatai. Yes, I'm in full agreement with that. And I think following on from what Flavia had mentioned at the beginning of her discussion is the competency-based education training is fundamental. But in order for that to be recognized, there needs to be a deliberate attempt to understand, the progression. So it's all good and well to train individuals in these skills, but what skills are really needed in the workplace and in the workforce? And that becomes elucidated with experience. So what I think in terms of the professionalization, and I completely agree with you, is that we need to recognize all occupations that form part of the service delivery in this goal. But most importantly, what professionalization allows for is that it allows for global confidence. And what we've seen in the COVID pandemic and through other health crises is there's an abundance of misinformation going around because of social media and the availability of information, both good and bad. And the public deserves individuals who they can trust to sift through the information for them and let them know, well, this is relevant, this is reasonable, and this is well done in terms of research, and this is a little sketchy. So if the public has that body that they can turn to and they can trust, perhaps we can better combat misinformation and fight all of these battles on multiple levels. Thank you.
Okay, thank you very much, Marine. I would just add that there are a number of links which we'll make sure are posted in the chat, which are the way in which you are encouraged to take part in the next phase of this work. There are a lot of things which we don't have an immediate answer to, but they are part of the agenda and part of what we need to be considering next. So if you don't get a direct answer to this, to your question today, please don't hesitate to get involved in the dialogue and post on the website, and also take part in the WHO survey. The comments and questions are coming a bit thick and fast, and I'm going to invite somebody from the WHO team just to respond on the idea of are there any country-based examples that we'd look to as good practice in workforce development and the kind of things that we're talking about today. Who'd like to come in there? Jim, you've got your
John, this is Jim, if I may, from the room here. I'll give the floor to Dale if I can quickly. Just wanted to intervene on the previous question, then one of our team will step in for that second question. Dale?
Thanks, Jim. Yeah, I'd just like to, I guess, reiterate what I said before, is that the countries that fared the worst during this pandemic were not the ones that had the least technical skills. There was no countries didn't do badly because their contact tracers weren't trained well enough, or even because their doctors weren't as good as doctors in other countries. And in fact, it also wasn't the domain of low and middle income countries, because many of them did very well during the pandemic in terms of preventing transmission, at least for a long period of time. You know, I would say the most, of course, you need the basic skills. I'm not taking away from that, but I'm saying the leadership and the coordination were the biggest failings, and that's one of the biggest lessons through previous measures of pandemic preparedness, was that we did go down and tick boxes and say, yes, strong in labs, strong in hospital systems, strong in contact tracing, but then when it came to the real event, it wasn't coordinated, or leadership didn't understand it, or the left hand didn't know what the right hand was doing. And I think this is really where, at least from an outbreak response point of view development, that's where the gold is. And the other place where the gold is in risk communications and community engagement. And Maureen spoke before about the infodemiology concept, and this is a whole new area that probably, I think it's just entering some universities now, but this is a whole new area that needs to be integrated as a complete pillar going forward. So every pillar needs to know what every other pillar is doing. They need to respect it, and there needs to be people in the middle, you know, probably ministries and things like that, that get it and that can coordinate it and can adapt their leadership style to make all the cogs turn as one. And I think that's where we saw countries' health systems that were stressed. Some did better than others, and that, I think, they're the two biggest things: the risk communications, community engagement, and the leadership and coordination. Thanks.
Thank you. Certainly the leadership is not a soft skill, and some of it can be taught, but I think, as you rightly say, the leadership and coordination is a very important element. And also, I think, Dale, repeating what you say, it was not something where wealthy countries have covered themselves in glory, and in fact many less technologically advanced or wealthy countries have done a whole lot better in the pandemic, certainly. Yeah, the question on following up that question about where there have been examples of strong practice, would someone else in the WHO team like to have a go at that?
Let me invite either Dr. Sohail, Dr. Kassoum, or Siobhan, just who are the technical leads of the action areas, if they can quickly intervene.
Jim, I was doing multitasking. Can I please hear the question again and then I can try to answer. Thank you.
Which countries have been doing well? Which countries where the capacity has been, we've identified where there is some good practice, not necessarily best practice, but good practice.
I think the situation now, given that we are still middle of COVID-19, I think it can be premature, I think, to confirm that there is a country that has been doing well. I think the country that has been considered doing well, I think there is a huge economic cost, there is a huge social disruptions. But at the same time, I think the countries that developed a better capacity, I think, between public health and zoonotic sector, I think not just in terms of the capacities in surveillance, but in terms of capacities, I think I can recall, I think, the work from the Guan and Dale in terms of the FELTP broadening the scope. I think those are probably, I think, well ahead in terms of understanding the 21st century, some of the less anticipated public health events. For example, I think there are some colleagues like Gabriel also putting this One Health aspect. I think the 80% of the agents are coming from animal reservoir. But at the same time, I think we are going to arrive into a fiscal constraint space as soon as the acute phase of COVID is over. I think while we can embrace the One Health, but at the same time, we also need to look at the other aspects of the public health so that the multidisciplinary workforce that we are expecting to develop can handle multiple stressors. But I don't think any country can claim that there is a very, very good practices given that huge socioeconomic cost, as we can see in the current pandemic. So even the traditional UHC index, traditional IHR index, traditional global health security index, unfortunately, they all came profoundly limited in terms of ascertaining capacities for public health. Although health workforce is one of the core components in all of those matrices. But unfortunately, the data doesn't allow us to say that, okay, this country's setup has done better than another country. But we all need to reflect and improve. Thank you, Jim.
Thank you, Sohail. Flavia, you
maybe
like to come in? Yeah.
Yes, I did want to comment very cautiously after my WHO colleagues said that there isn't any one country, but I think in South Africa, certainly, I must say that our progress has really been, something that other countries can learn from. I think not only in terms of kind of the technical skills of having some of the top scientists in the region, ensuring that, there is a kind of understanding of what is going on in terms of the pandemic. But certainly one of the things that has that assisted us was certainly our diversity and our community health program. You must remember, John, that COVID-19 found us in South Africa with a quadruple burden of disease. And so on top of that layer, I think we expected to have a decimated health system. But I think that we have not only pivoted out of COVID-19, ensuring that even the essential health services still continue in the face of managing a pandemic. So I really do want to just share with colleagues that one of the countries where we can share best practice is certainly South Africa. Thanks, John. Over back to you.
Thank you very much, Flavia. I'm sure you're absolutely right. The example of South Africa has been, particularly in the context of what we're talking about today in the workforce development and capacity building, has been a very shining example. So thank you. I've got to close down this discussion now, but as I say, if you want to carry on this debate, we hope you will, because we do need people to take this agenda forward, to take the journey on the roadmap. and we are offering our support to assist people with the journey. There are a lot of questions being asked about technical or cultural issues like legal aspects, insurance. All of these things are extremely important in developing public health as a profession, and you know, certainly there are no immediate answers, and things will need to be culturally appropriate for individual countries. And you certainly have my assurance that I'll be very pleased to work with others to progress the agenda in across the world. Seems to me that there's competencies we have to develop which determine what public health professionals have and what they look like. There's curriculum, which is what schools of public health and other teachers need to be able to teach. And then there's also professionalization, which determines how our professionals behave and how they secure public trust and how they demonstrate that they are there to protect and improve the health of the public. If we get all those things right, we'll certainly have a better public health system for the future and better prepared for future pandemics. So with that, I'll hand back to Jim to conclude the event for us. Thank you.
Thank you very much, John, and panelists, and to all the participants for the Q&A, the chat that's going on. For my colleagues in the background, some of those have been answered in written. What we'll do is we'll also compile all of those and make sure the conversation continues through the event page and the community of practice that we will establish to come together. Just then a few final comments and thoughts before we wrap up the session today accordingly. So today is a milestone with the launch of a roadmap, but it is the launch of this vision for the next 5 years. How do we use the tools to benchmark, inform the dialogue, reach decisions, put in place that policy action with, we've heard from several people, the necessary investment. How do we look at the context, the education, the competency-based education, the jobs that are needed accordingly, and that classic line there that a strategy is not a strategy without a budget is so very true. We are going to be faced with some challenges around the world. The economic scarring from this outbreak, this pandemic, along with the economic scarring we're seeing from conflict and other emergencies, the economic scarring also that we're going to see from climate, rising food prices, fuel prices. At the same time, our governments are going to be challenged to put continuing increases into education, into health, into social protection, into the social determinants, which have a huge bearing on prevention and promotion of diseases across the life course. And so, colleagues, we're going to have to be better at our roles in terms of getting the efficiency, the effectiveness of the investment that we call for into what I think Flavia said was the embodiment and personification of any health system, the health workforce, the people that provide these services, the people that are there when called upon in an emergency. At the same time, with that economic scarring, we've got political, diplomatic discussions around the future global health architecture, the future discussions on preparedness and response. We have these deliberations. Governing bodies meetings have started today. Dr. Sosse has had to go back into some of those meetings now. At the Health Assembly next week, a full discussion on some of these issues. in parallel, intergovernmental negotiating body discussing what might be the future pandemic treaty to come forward. And I think we have to bring some of the voice and some of the discussion we've heard today that we must not necessarily be shy in a critical appraisal of practice and performance and behavior through this emergency. I think Dale's suggestion about how we realistically do after action reviews, that we look at the deficits, has got to be part and parcel of that benchmarking and those honest discussions and reviews in each and every country, in each and every jurisdiction. I think, as he said, what is often referred to as soft skills is actually a core competency to diplomacy, communication, coordination, trying to ensure that science becomes implemented is part and parcel. If you saw recently on LinkedIn, they produced a survey of all the results of what are the core competencies that are coming to the fore in the wealth of job descriptions that are marketed on their site. And it's exactly this, it's leadership. It's the ability to review data and information and take decisions, sometimes in the absence of a perfect information set. And this is what public health has been doing and continues to do. It is that leadership role. So how do we build the competencies going forward for that? I'd like to just say thanks to all the partners, to all my team, the team in the emergencies division, the Global Outbreak and Alert Response Network that have been actively engaged in all of this work, the team that are behind the logistics, the IT, the interpretation today. These events can't happen without all of these people. Like I said, but this is only the launch of a starting process. We will be reaching out to all of you who've registered and engaged, all the partners, about how you can support us. Please do use that endorsement link to identify yourself to us and how you would like to contribute. And our commitment is, as WHO, as a convener, is that we will reach out to you to take that work forward. I wish you all well, whether that's a morning, afternoon, evening, and to all our panelists and speakers, thank you once again, and to our early career professionals, Flavia and Marine, for kicking us off on this start. May you all have a wonderful day and enjoy yourselves. Thank you.
Thank you. Thank you, Jim.
Thank you all.
Bye, everyone.
Thank you.
Bye-bye.
Bye.
Hi, many thanks.
Bye-bye.